Knock, knock, knock. Hello, I'm Monica. I'm your nurse. I'm here to do an in-depth assessment on you today. Can I get your name please?
Shabazz.
Thank you, Shabazz. What is your date of birth?
1583.
Okay, and do you know where you are right now?
I'm in a examination room.
Okay, and you know for what purpose you're here?
For a checkup.
Okay, perfect. Thank you. So I'm going to go ahead and I'm going to wash my hands. And as I do so, I'm going to note the overall health of my client. You can see that his skin is appropriate for his ethnicity. He's got good posture. I'm not seeing anything wrong there. His hair distribution looks good. And he is ANO times 4, alert and oriented to a person, place, time, and event. Okay. And I'm going to be doing an CMS approach, which is circulation, motor, and sensation approach. I'm going to start at the top of his head, and I'm going to be looking for any nodules or pain. Do you have any discomfort or pain while I do this?
No.
I'm also checking for the overall shape, and I would say he is normocephalic, which is good. Okay, I'm also going to check your skin, and it is warm and dry. I'll check for tinting or turgor. There's no tinting, that looks good. Check your arm. I'm not seeing any edema. Your cap refill are all under 2 seconds, which is good. Can you squeeze my finger? Can you pull me to you or pull me away? Perfect. Thank you. I'm going to go ahead and palpate your frontal and maxillary sinuses. Do you have any discomfort when I do this? On this? Okay. And I'm going to go ahead and check your cranial nerve 5, motor master. You clench your teeth, open your mouth, clench. Any pain? Okay, I'm not feeling any clicking or grinding, so that's good. I'm going to go ahead and check your cranial nerve 5 sensory 3 branches now. Go ahead and close your eyes, and I'm going to brush it on your face. I want you to tell me where you're feeling it. Okay, good. Okay. And now I'm going to have you, I'm going to check cranial nerve 7. So can you raise your eyebrows? Okay, can you smile, big one? Frown? Puff out your cheeks? Excellent, thank you. Okay. Perfect. Now I'm going to go ahead and I'm going to look at the trachea. Everything looks midline. Good. I'm going to go ahead and check the thyroid. Can I have you lean your head forward and to the right slightly? And go ahead and swallow for me. Okay, good. Okay, so it was slightly palpable, but I did not feel any nodules or anything like that, so that looks good. Okay, I'm also going to go ahead and check your lymphatics. So I'm going to go ahead and check your preocular, postocular, occipital, okay, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular, and infraclavicular. I was looking for anything swollen, hard, movable. I was unable to feel any of his lymph nodes, which is good. I'm going to go ahead and take a listen to your carotid artery. I'm listening for breweries. And I hear nothing. That's good. Just normal sounds. I'm going to check your cranial nerve 11. Can you raise your shoulder up, down? And go ahead and press your face against my hand. Excellent. Alright, I'm going to go ahead and check your ears over now. Got this little gadget. So I'm going to go ahead and palpate the exterior ear first. So I've got the helix, the pinna, the earlobe, the tergus. Do you have any pain when I push on that? No? And I'm going to go ahead and look inside of your ear. I'm going to pull the pinna up and back while I look. And I am noting the tympanic membrane, the ombos, and the malleus. Okay. That's it. No. I'm going to go ahead and do a couple tests. I'm going to do one where I'm going to be behind you and I'm going to whisper something. It's called a whisper test. And I want you to tell me what you hear.
Okay. Hello.
Very good. Okay, and then I also want you to go ahead and you're going to stand up for me. This is called the Romberg test. I want your feet together. I want you to close your eyes. And I'm going to time you. I want you to just go ahead and just stand there for a minute with your eyes closed. I'm going to watch for 30 seconds. And everything looks good. For the purpose of this exam, we'll just say it's been that amount of time. So you can go ahead and sit back down. I'm going to go ahead and look at your nose. I'm going to go ahead and just look in your nose really quick. And I'm looking at the middle and urbanus. Okay. Everything looks like it should. Inferior urbanus, sorry. Now I'm going to go ahead and I want you to go ahead and occlude, meaning plug one nostril. And I'm going to put a scent under your nose. I want you to tell me what you smell.
That's an essential oil.
Perfect. And that is testing your cranial nerve number 1. So now we're going to go ahead and take a look at your eyes. So we tested for your cranial nerve 2, your visual acuity using the Snell chart earlier. And now I'm going to go ahead and check your pupils, the perla. So can I have you close your eyes? Go ahead and open them. Go ahead and close them again. And open them. Thank you. Eyes are equal, round, reactive to light, like they should. Okay, now I want you to take this here, cover up one of your eyes, and I want you to look right at this pin right here, and go ahead and remove that. Open your eyes. I do not see any business, so that is good. Okay, now I'm going to check your cranial nerves 3, 4, and 6. So can you please follow the light, or the pin? Sorry. So that's 3, 4, and 6. Perfect. Good. Oh, just need to look inside your mouth too. And mucous membranes are pink, moist, intact. Looks good. Can you say ah for me? Nice and big. Okay, so the soft palate is moving with the uvula, which indicates that the cranial nerves 9 and 10 are intact. And I was unable to see tonsils, so I would rate them or score them as 0. I was unable to see them. So now we're going to be going to the chest. That kind of fell apart. It's got a 2-to-1 ratio, which is what it should be. And then have you had any chest pain or difficulty breathing? No? Okay. I'm going to go ahead and just listen to the back of your... Do you mind rotating a little bit? Sorry, the other way so we can see your back. Okay. So I'm going to be using a Z-shaped pattern. Can you take a nice deep breath for me? One more. I'm going to have you do that again. I'm going to check your, it's called egophony, and I'm going to have you say E while I do the exact same thing in the Z pattern, okay? Okay. Everything sounded normal and good. I would also have auscultated the breathing sounds on the lateral and anterior side as well. Now I'm going to test for the, what's it called? I can't ever say 3-mitis. 3-mitis. I'm checking for vibrations to be equal on both sides of the body. I want you to say blue balloon.
Blue balloon.
Good. Again?
Blue balloon.
Perfect. Again?
Blue balloon.
Again?
Blue balloon.
One more time.
Blue balloon.
Good. Felt really good. Everything was equal. Equal bilaterals, and just like it should be. Okay. So now we're going to do our cardiac assessment. Go ahead and lay down for me. Okay, and I'm going to go ahead and just check for heaves or thrills. I'm going to kind of just put my hand here and I'm watching for it. And I'm not seeing anything. It looks like it should. Now I'm going to go ahead and just listen to the different parts of the heart. I'm going to start with the apical, I mean, I'll say the aortic, pulmonic, verbs, point, tricuspid, and the mitral. S1 and S2 are both audible. You can best hear S1 at the base of the heart and S2 at the apex of the heart. Also the chest, again, the temperature of the skin is good, and the skin looks good. I'm going to go ahead and move on to the abdomen. I'm going to lift your shirt up, okay? So I'm going to just inspect it before I do anything. I'm seeing that it's flat, it's not distended, it looks soft. I'm not seeing any bruises or cuts or any discoloration of any type. So I'm just going to go ahead and auscultate the 4 regions of the abdomen. I'm hearing vowel sounds. Have you had any nausea or vomiting? Okay, I'm going to press on your tummy. I want you to tell me if you have any discomfort. I'm going to go ahead and do some light palpations on the abdomen. Any discomfort, pain? Okay, I'm going to go ahead and palpate a little bit deeper. I'm going to feel for the liver. Go ahead and take a nice deep breath. And then roll it out. Good. Nice deep breath. Roll it out. I'm going to feel for the spleen now. I'm not feeling the liver or the spleen, which that is normal findings. Oh, I need to listen to. I'm going to listen to, I'm going to tap on your belly now, okay? having tympani, and that's normal. So that's very good. All right. Now we're going to check your muscle skeletal. So what I need you to do is I'm going to have you bend your knee up to your chest, and then bring it out, and then back in, and then down. Okay, good. You have good range of motion. Okay, I'm going to have you point your toes to your nose. This is your dorsal flexion. Good. And then down like you're pushing gas. And that's there you go, plantar flexion. Very good. All right, you can go ahead and sit up. Okay, go ahead and have you flex your arm. Actually, go ahead and just do this one. And then bring it out. And then you do a big circle if you can. Okay, good. You have good range of motion in your arms. Alright, so I'm going to grab a couple of items. I'm going to have you close your eyes, and this is called the stereonos test and the graphopenia test. So I'm going to put something in your hand, your eyes closed. What else? Oh, yeah. Sorry about that. Put something in your hand, close your eyes, and then tell me what it is. Test. Now I'm going to do the graphopenia test, and that is I'm going to draw on your hand, and you tell me what it is. Very good. Okay, now I'm going to check your senses. I have two objects in my hand. One is sharp, and then one is dull. Sharp feels like this. Dull feels like this. Okay. Go ahead and close your eyes. Tell me what you feel. So now I'm going to have you take your hands. What you're going to do is you're going to take your hands out wide, and I want you to close your eyes, and you're going to touch your fingers to your nose, back and forth. Good. Okay. Now you can put your hands in your lap, and I want you to supine and pronate your hands. That's like this, back and forth, as fast as you can. Good. Everything looks good. Good job. All right. Okay, so now I'm going to have you, I forgot to do that. We'll do it real quick. I'm going to have you lay back down real quick. Sorry. And then you're going to take your heels, and you're going to actually rub the inside of your heel against the inside of your leg. Just run it right down. Yeah. All the way down your leg. Okay, great. Now I'm going to have you stand up. Moving all over the place, I'm sorry. So now what I want you to do is I want you to start from over there, and I want you to walk towards me on your heels. And I'm watching on your gait. Good. Okay, you can turn around and watch on your tiptoes. Good. And I'm walking gait. Good. All right. You can come back, sit down, and I'm going to go ahead and check all of your reflexes, and then we'll be good to go after I check your pulses also. Okay, so before we begin, I'm going to go ahead and check your pulses. I'm going to check your occipital pulse, your carotid pulse, your brachial pulse, radial pulse, okay. Check your posterior tibialis pulse. I'm actually going to take your sock off so I can feel it a little better. Okay. And your dorsal pulse. But you got a good one. And I would note that those were, I would say that they were, I would check both sides and decide if they were bilateral, equal bilateral, and I would say that was a 2. There you go. Now I'm going to go ahead and check your reflexes. I'm going to check your bicep, tricep, wrist. I always call it the brachial radial reflex, by the way. Brachial reflex. Achilles reflex. Did not get it. Let's try again. And then your Babinski. I would say it's there, but not quite as strong as I anticipated. All the other ones. Alrighty. And that be that. Thank you very much. I appreciate it. I'm going to wash my hands again. And I'm going to chart my findings and say goodbye to my patient.
Thank you.
Thank you.